Welcome, welcome. My name is Rachel, and I will be presenting today on exercise in pregnancy and postpartum, specifically looking at returning to activity and help you feel good again during and post pregnancy and breaking down some of the myths around exercise in pregnancy and postpartum. So, this is a recording of the presentation that was performed on July 30th on our Limitless Life Community app. So, just first, a little bit about me. My name is Rachel. Like I said, I work at the Cortland Limitless location. And a little bit about me is I live on a wonderful hobby farm with my boyfriend, Drew, and our dog, Deke. Um, I like making bread and canning things and making jams and jellies, spending time in my flower garden, um, and going hunting with Drew and our dog. Today, we are specifically going to be talking about some of the myths behind exercise during pregnancy and postpartum, like I mentioned, and we are going to help you develop a plan to help you return to your goals, as well as teaching you and educating you a little bit about how PT can help you get back into exercise during this pregnancy and postpartum period specifically. To get us started, we're going to see a video about Miss Hannah, who came to Limitless for her symptoms of urinary incontinence and getting back into exercise with pregnancy and postpartum.
My name is Hannah Andrus, and I am here for pelvic floor therapy. I first started coming because when I was like 6 weeks pregnant, I was throwing up and I was starting to have some urine leakage, and I knew from coming here previously that that wasn't normal, and it was something that I could like work to get rid of. So I called and was able to get in pretty quickly right at the beginning of my pregnancy. So with my first pregnancy, I came here because I was having pelvic pain when I walked, and I was able to actually get rid of that pain during my first pregnancy because of what I did here with Limitless. I mean, everything. You know, I had a much more comfortable pregnancy this time around because I started coming right in the beginning. I also was able to maintain a lot more strength than I did in my first pregnancy. My recovery this time around has been a lot better. I've been able to get back to doing things a lot more quickly than I did with my first. Postpartum period's just been a lot different.
My name is Arissa Kyler, and I specialize in pelvic floor physical therapy. So for Hannah, I started seeing her when she was pregnant, and she was having some urine leakage like she mentioned, like with throwing up, unfortunately, sometimes coughing and sneezing. So we worked a lot on pelvic floor coordination to brace against that and making sure she had good range of motion to do that. And then we also worked on strengthening her pelvic floor, thinking bigger picture during her pregnancy. So working on core strengthening, hip strengthening, pelvic strengthening, all the things that you have to do to be a mom. And then as we shifted more into her like later third trimester, we got more into like birthing positions, how to push, how to breathe, different considerations like that. And then looking forward to like outlining her postpartum plan of care too.
So like initially it's great because like I was able to call, and I think they got me in like within a week, which was great. And then throughout my pregnancy, just kind of as I've gone through like different stages of pregnancy, different trimesters leading up to birth, it's great.
So that is a little bit about Hannah and her experience here at Limitless. So we want you to know that you are not alone, and you are most certainly not the only person who is experiencing urinary incontinence or pressure symptoms or fatigue or lots of different symptoms in pregnancy and in postpartum. And you are very much so not alone, and we are here to help you. It is our mission here at Limitless to help grow a thriving community that helps inspire the best healthcare outcomes. And that most certainly starts with you coming in and being a part of our family and you being able to, have this like nice supportive environment with us PTs, our care coordinators, all of the staff, and all of the patients here as well. You are most certainly not alone. So we have several core values here at Limitless. So we are thriving people. We help to recharge and serve others. We know that we are all better together. We are better working with you, and we are better as a team, and we are better as a community. We focus on reaching as well. So we really want to help you reach your goals and continue to expand your horizons and meet your visions and help to shape your goals in a positive way. We also want to make sure that we are earning it. So we help to make sure that we are delivering the best possible healthcare to you without expecting anything in return, because we don't. We want to make sure that you are the best possible version of yourselves. And we also really want to make sure that as a community, we are creating an impact. We want to be the best for you, create the best community for you, and create the best scenarios for you to have the best outcomes as well. A little bit about some of the other things that we treat, just so you know, is we also treat ortho conditions and balance and dizziness, as well as our pelvic health, um, like sectors as well. So we treat athletes and older adults and younger adults, and we treat post op and pre op and work injury and pain and balance issues and concussion as well. So we treat lots of other things here as well. But specifically, we're just going to look at pregnancy and postpartum today. But if you have any questions about those other aspects, feel free to reach out to us, and you'll have our number at the end of this presentation as well. So let's really get into this. What is the real problem, right? The real problem is that we, in pregnancy and postpartum, there's a huge misunderstanding with exercise of what you can be doing, what you shouldn't be doing, who says what, the different recommendations, if there's anything specific that you should be doing during certain time frames, right? Which then leads us to not exercising at all, right? Which is not what we want to be able to do. We want to continue to exercise in pregnancy and postpartum, but with so many different recommendations, we don't exercise, right? And with so many different recommendations of how to breastfeed or how to do sleep habits or what we should be doing nutrition wise, right? Then we don't pick any recommendations specifically, and we're just flip flopping between all of these different ideas, trying to make the best decision when in reality, the best decision for us and for our baby is to do the things that make the most sense to us and what works with our schedule and our life, right? And that's what we're going to talk about today. And that's what we're here for you for, is to help you make these decisions. So, right, like that's why we're here. So, what's next? We're going to get into the nitty gritty, right? And we're going to help you to figure out why we're having a hard time with all these different recommendations. But we're also, when you come to PT, we're going to help you find the root cause first as to why you're experiencing those symptoms. Then we're going to help you fix those symptoms. And then we're going to help you for future, right? Like we fix the cause, but what comes next, right? Like what do we need to make sure that we do so that these symptoms don't come back? So first, if you come in for PT, like I said, we're going to find that root cause. So we're going to talk through all of your symptoms. We're going to figure out what's going on. We're going to talk through everything you've been experiencing. We're then going to go through and assess. We're going to see how you're moving and grooving. We're going to see if we can recreate any of those symptoms. And then we're going to educate you on what we're looking for and what we saw. Okay. The next piece of it is fixing it, right? So now we've gone through, we know what you're experiencing, we have a good idea of what's going on, we've educated you on what PT is going to be looking like, but now we're going to help you to fix those things. So we're going to put into action a plan of care that makes the most sense to you, that is super original to you, and we're going to educate you on what we're going to be doing further on. And we know that getting in some exercise is super important, so we're going to make sure that we add that in as well. So this is getting in a little bit of how we can help and some of the education that we will be doing when you first come into PT, right? So we know that urinary leakage does not always mean that you are super weak. You can have a super strong and overactive pelvic floor and still be having urinary leakage. So it was found in 2018 that athletes with a stronger pelvic floor contraction, so you're able to Kegel stronger, actually had increased incidences of incontinence that those that were continent that didn't have as strong of a pelvic floor contraction or that Kegel. That doesn't mean that we don't do any Kegels, right? It's just showing that, hey, like we actually can have leakage and our pelvic floor is not actually too weak. It actually is working a little bit too hard, causing us to have leakage. Diastasis recti does not mean that you are weak. You can have gapping of this linea alba here, right? We're going to have some gapping during pregnancy to help make room for baby. But just because we have some gapping doesn't necessarily mean that we're weak. If we can have a good, strong core contraction and we can have some approximation of these tissues, it doesn't mean that our core still can't function proper. It can function proper and we can still have this gap here. Exercise does not cause prolapse, okay? It is a lot of people like, I can't exercise during pregnancy because I'm going to have a prolapse. That is not the case. We found that individuals have some prolapse, right? And it's normal to have some prolapse and you have no symptoms, especially in this postpartum time frame, because everything is a little lax. But exercise itself is not what's causing the prolapse symptoms, okay? And we found that 50% of individuals have some level of a low grade pelvic organ prolapse, and only 3 to 8% of those actually have that sensation or that pressure or falling out feeling. And it's not because they exercised, okay? It is because they had a little bit of increased laxity. They maybe didn't have proper, pressure management, and they started to have some of these symptoms, okay? In addition, we have found that strength training and exercise do not negatively impact mom and baby when you are pregnant. They actually found that there was no negative effect or no decrease in blood flow to the fetus with high intensity resistance strength training during pregnancy, working at 70, 80, and 90% of someone's one rep max with the Valsalva, which is a brace and a breath hold. There was no decrease in blood flow or negative effect to the baby, which is actually saying the opposite of what lots of people are saying of, oh, I can't do this, it's going to hurt the baby, or I'm not going to be breathing, that's going to harm the baby, baby isn't going to get blood flow, isn't going to get oxygen. This research is showing us that that actually is not the case. It is very safe for mom and baby. In addition, not exercise and lifting in pregnancy can lead to further deconditioning and underloading of the body. Okay, let's talk through this. Okay, when we are exercising and lifting in pregnancy, right, we are becoming stronger. We are then taking on and loading our body heavier than just our body weight, right? If we then, in pregnancy, our body is changing and we're not loading our body is changing. We were able to maintain before without pain the load of our body, but now we are growing a baby. So we are going to have increased load on our body. And if we are not able to be strong enough to maintain that load, we're going to have symptoms, right? And it was found that lifting and exercise during pregnancy further deconditions us and underloads the body, which then can cause some pain, decreased core strength, some symptoms of incontinence. And it actually was found that runners who performed resistance training, so that nice heavy strength training during pregnancy, had a 48% less likelihood of having postpartum pain. They were 49% had decreased perception of the diastasis recti symptom, and 54% were less likely to have postpartum stress urinary incontinence, which is just crazy, right? Like individuals who strength trained right? Even if it's something where they can't do super heavy lifting, who loaded their bodies during pregnancy had decreased symptoms in postpartum. Okay. So we're getting into developing this plan that is super original to you. So we're going to break down some things that you can do during the different trimesters of pregnancy, in early postpartum, and then later in postpartum as well. Well, in reality, it's going to be doing what makes the most sense to you and meeting you where you're at. These are some things that we can focus on. All right. So, before we get started, it is super good to know some cardiovascular norms during prepartum, first trimester, second trimester, third trimester for our blood pressure, our heart rate, our oxygen saturation, and our respiratory rate, because it does change ever so slightly when we are pregnant. Okay, so we see a little bit wider range for our respiratory rate. We see a little bit of a change of some increased blood pressure, not anything super crazy, but the range is definitely increased. And we do see an increase in our heart rate during pregnancy. So these are good things for us to be able to keep track of, especially for monitoring these things during pregnancy to make sure that we're having a good response to exercise. So, a little bit of contraindications to exercise during pregnancy would be some of these signs and symptoms that we need to look out for. Some of the contraindications, okay, I really shouldn't be exercising, would be unexplained persistent vaginal bleeding. So, a large amount of bleeding, severe preeclampsia, a ruptured cervix, being faint or dizzy, being short of breath before you start exercising, having a non-reducible headache. So you take medicine and it does not touch it. You try several things and you cannot change it, and having chest pain. Okay. Over here on the right, these are some signs and symptoms of preeclampsia. Okay. Having an increased blood pressure, swelling of the hand's face, difficulty breathing, changes in vision, nausea after mid pregnancy, a headache that will not go away with meds, and weight gain of more than 5 pounds in 1 week are symptoms of preeclampsia and something that we should go to our doctor for. Okay. So we can have preeclampsia in pregnancy and in postpartum. And we are really specifically looking at postpartum during that first 48 hours to 6 weeks of postpartum, of that increased blood pressure, increased protein in our urine, having that severe headache, changes in vision, right upper quadrant pain, and decreased urination, and tells us it's something that we should go see our doctor for. Okay. Some exercise considerations during pregnancy is we're going to exercise per our tolerance, like I mentioned, continuing to load the body, and we're going to be aware of those red flags, those contraindications on the last page, okay? Or precautions that we should be aware of. You're going to hear us repeating a lot of things during this, okay? So, in general, for pregnancy, our exercise recommendation is going to be performing per our tolerance. So, we're going to strength train 2 to 3 times a week, or 20 to 30 minutes of aerobic or strength training most days, okay? If we're strength training that 2 to 3 times a week, we're going to try to get in this 150 minutes of moderate intensity cardio during the week. That being said, this is going to be made super original to you. If you weren't exercising before pregnancy, it might not be something where we jump into this many strength training days and this much cardiovascular training at the get go, right? This might be something that we build up to, but it's super safe for you to start exercising during pregnancy as well. So it's never too late to start. Okay. Some of the benefits of exercise during pregnancy is it helps to manage gestational diabetes. It reduces the risk of hypertension, preeclampsia, and urinary incontinence in pre and postpartum. And we also found that individuals who did this strength training had lower rates of prenatal mood swings, postpartum mood swings, gestational hypertension, and decreased incidences of needing a C section. So, during pregnancy, like I said, we're going to break it down the first, second, and third trimester. Okay. Knowing that this is going to be something that's made super unique to you. But our first trimester, we're still going to exercise, load, and train per our tolerance. And our limitation is going to be based on the symptoms that we are experiencing. Okay. So we're going to continue to progress our mobility and our range of motion. We're going to strength train and load per our tolerance. And we're going to work on our overall endurance. Some things that we can do for this is going to the gym, going to PT, going to workout classes, doing yoga, running, or maybe you decide to start like some birth classes. During our second trimester of pregnancy, same thing. We're going to exercise, load, and train per our tolerance, and we can increase our strength and load the body without harming our baby, right? So we're still going to strength train. We're still going to work on our endurance. We're really going to start working on our hip and pelvic mobility to allow for ease of birth, to make sure we have nice range of motion there for making room for baby. And we're going to start doing some pelvic floor muscle training. Make sure that we have good pelvic floor coordination so we know how to properly push when we're in labor. Some ways that we can do that, right, is going to the gym, working out, going to PT, going to yoga, running, going to a birth class, right? Third trimester, same exact thing. We're going to load and strength train our tolerance. At this stage, we might need to decrease some of these like higher load things, such as running and jumping and high impact exercises, just due by having some increased pressure symptoms when doing this, urinary incontinence, pain during some of these, right, as baby is growing. If you come to PT, this is something that we can super help you with of finding exactly right um this right loading tolerance. We also can educate you on proper pelvic floor muscle training, birth prep, and different positions for labor. We can work on a perineal massage to help with desensitizing the tissue for during labor. We're also going to continue to progress hip and pelvic mobility. You're still welcome to go to the gym. You can still go to workout classes. You can still do yoga, go to your birth classes. And obviously, you're welcome to come to PT as well. All right. Now, postpartum. So, we're going to do early postpartum and then kind of break it down into some other phases of postpartum. But once you've had a baby, you are postpartum for life. Okay. So, for postpartum, we like to see you return and begin PT within those first 2 weeks of postpartum, right? We can help you check in on some of those preeclampsia symptoms as well. Make sure that you're loading your body properly, that you have good mechanics with lifting your baby, right? If you're having pain, we can help you with that, right? We also can help with like C-section scar and tear scar C-section scar awareness. We can do a little gentle return to exercise. During this phase, you're really going to be prioritizing sleep, right? Making sure that you're taking care of yourselves. Okay. We're going to do some gentle movement. We can work on some mobility and some pelvic floor work. And we're just going to work on our strengthening per our tolerance while prioritizing our sleep. In like 3 to 12 months postpartum, we can really start to get into like some functional strength training, lifting mechanics, loading progression, and really working towards your individual goals, right? So we're going to first start off with body weight exercises, then we added maybe some light weights and resistance bands, and then we can get into some increased loading of the body through strength training, right? But this is something that maybe you're ready to do this before 3 months, and that's totally okay too, right? Like this is going to be made super unique to you. And then in 12 months plus, this is where we're continuing to progress our strength, our endurance, our loading tolerance, our volume. And we're going to really be working towards your goals, whatever those look like to you, whether it's getting back into doing half marathons, or it's being able to work in your garden, or sitting for a certain period of time at work so you can type your notes appropriately, right? Like we're going to help you progress towards those things and improve your strength and returning to those things that you were doing in pregnancy and prepartum as well. Or maybe you weren't doing those things before pregnancy and now you really want to. So, This gets in to that future proofing your body, right? Like we're going to make that plan of care that's super unique to you and help you focus on your bigger why and your goals and help establish some habits in pregnancy and postpartum that you can carry on for life. We know that it's almost like a 1-to-1 ratio of us as parents exercising. We then see our kiddos exercising too, which is just going to immensely help with long term health, right? Making sure that we're in shape and we're healthy. Okay. So, what I'm going to have you do is I want to give you a little snippet of what it might feel like on one of our first visits when you're at PT. Okay. So, I want you to put a hand on your chest and a hand on your belly, and I want you to do some nice deep breathing. I want you to think about where you're feeling your breath first. Are you feeling it in your chest? Are you feeling it in your belly? Feel like you're pushing out your belly to try to let your belly rise. Okay. When we inhale, we should be inhaling, doing this nice deep belly breath down into our belly without pushing our belly out, and then exhaling, letting everything fall. Okay. Think about breathing down into your lower ribs. Everything is super gentle. Okay. If you need to pause this, as you can do that a few times, you are more than welcome to. The next piece is doing this nice core contraction, okay, and bracing. Once you put your hands on your belly and think about someone's pushing you, punching you in the gut, what are you going to do? Are you pushing your belly way out? Are you sucking your belly button way in? Are you not really able to figure out how to do it? These are things that we would help you with when you came to PT to make sure that you are properly engaging your core so that you can help with proper pressure management of our pelvic floor in this core canister. Because with nice deep breathing, when our diaphragm goes down, our pelvic floor needs to be able to lengthen a little bit. When our diaphragm comes up, our pelvic floor needs to come up a little bit, needs to contract, have a little tone in it to help account for that change in pressure. In addition, with our core contraction, if we aren't able to properly brace, we might be pushing our belly out and putting a lot of increased pressure on our pelvic floor. And then we get symptoms with exercise when we're trying to do core activities, right? So these are just some things that we would be able to address when you came to PT. So, what is the next step? What does this mean to you, right? And what can you do next? I want you to sit and think about after this presentation, what is everything that we just talk about? What does it mean to you? And what can you do next? Okay. I want you to think about 3 months from now, a year from now, what that looks like. In a picture perfect world, what would you be able to do if you implemented exercise, if you came to PT, if you did all the things that you wanted to be able to do to help you in pregnancy and postpartum? And now I want you to think about what happens if you don't do it, right? What does that look like to you? What would it look like? Right. And we thought about what happens if we do act, right? What does that look like to you? What would you be able to do? I want you, like I said, to imagine your story a year from now if you did act and if you didn't act and what the difference is. Okay. If you start your journey here today with you and join our thriving community, we are going to be here to help you to meet your goals and help you be the best version of yourself a year from right now. Okay. If you call, if you call the Cortland office, you'll be meeting with Miss Amy and she will help you get scheduled. In addition, we have all of the phone numbers and location of our Victor, Brighton, and Greece office to help you get scheduled with an appointment as well. If you have any questions, please make sure that you reach out. Don't be afraid to reach out to all of us, and we are happy to help you.